What is solubility? Solubility is the maximum amount of the solute that can dissolve in the given amount of the solvent at a specific temperature and pressure, forming a stable solution. Hi everyone, welcome back to my channel Pharma Talk with Imran. Today's video topic is solubility. So in this topic, we are going to study various solubility enhancement techniques and their basic concepts. So let us start the video. What is bioavailability? Bioavailability is the amount of drug that reaches the bloodstream in an unchanged form, irrespective of any route of drug administration like oral, parenteral, etc. after its administration. Bioavailability actually tells us how much of the drug is actually reaching to the site of action after its administration to the body in order to produce a therapeutic effect. For example, if 100 mg of the drug is taken orally and only 50 mg of the drug is reaches the blood circulation and reach the site of action, then the bioavailability of the drug is 50% only. Uniform drug distribution is the equal distribution of the drug particles throughout the liquid system. Miscible liquids. These are the liquids which are completely miscible with each other. That is, there is no phase separation. Example, water and chloroform. What is dielectric constant? It is the measure of solvent ability to reduce the attraction between the charged particles. Then what is polar solvents? These are the solvents that have positive and negative ends and can dissolve polar substances and ionic compounds. Polar solvents are the liquids that mix well with the water and dissolve salts or polar drugs. Then what are non-polar solvents? These are the solvents that do not have positive and negative ends and dissolve non-polar substances. Non-polar solvents dissolve oils, fats and non-polar drugs but do not mix with water. What is uniform dosing? Uniform dosing means each dose of the medicine contains same amount of the drug. What is non-uniform dosing? Means each dose of the medicine does not contain the same amount of the drug. So, what are the main problems with the poor solubility? The first thing is it may lead to low bioavailability. Means if there is a improper or inadequate dissolution, that will lead to poor absorption and reduced therapeutic effect. If the solute is not properly dissolving in the solution, then it will affect the absorption of the drug. If there is no proper absorption, definitely we cannot expect a good therapeutic effect from that drug. Then variable absorption. As I said, if there is a problem with the dissolution, definitely it will affect the absorption process, and there is a inconsistent blood concentration of the drug. Concentration of the drug in the blood, which is result in unpredictable therapeutic outcomes. Means we cannot expect a desired therapeutic effect if there is no proper absorption of the drug. Then higher doses are required. So that will lead to, if there is a no proper absorption, then we cannot expect the good therapeutic effect. So because of that, there is a need of administration of more and more doses. That is, higher doses are required. That again a risk of toxicity or adverse effect on the body. Then here, why enhancement is critical or important in case of liquid dosage forms? Because here mainly the liquid dosage forms are specially used in pediatric patients, that is in children. So because of that, the patient compliance is very much important. Then rapid action. So the solutions or the liquid dosage forms provide faster onset of action as compared to tablet and other dosage forms, other solid dosage forms. And here we can achieve the dosage flexibility also. So we can adjust the dosage as per our need. So it is not possible with the unit dosage form, that is in the tablet. Then commercial variability. Enhanced solubility improves the product marketability. Means if there is a enhanced solubility, then there is a good absorption in the absorption of the drug in the body, then enhanced therapeutic effect that will create a good impact on the product performance. Now, what is the importance of solubility, especially in liquid preparations? Why solubility is more important in case of liquid preparations? Because of the following reason. So it will ensure the uniform drug distribution throughout the liquid phase. If this is the liquid phase, then there is a uniform distribution of the drug throughout the liquid phase. And it also prevents the drug precipitation during the storage. So when we are going to store the product, if there is no proper solubility or uniform distribution of the drug molecules in the liquid phase, then that will leads to precipitation or settle down of the solid material at the bottom. Then it facilitates the oral and parenteral liquid formulations, and it will also improve the bioavailability. Then enables accurate dosage delivery. Now we will discuss about the solubility enhancement techniques. In the previous slides we have seen what are the problems which are going to occur if the solubility is not good in the solvent system, especially in case of liquid preparations. So now how can we overcome from these problems? That is the solution. That is called as solubility enhancement techniques. We can increase the solubility of the poorly soluble drugs, by these techniques. The first one is by pH adjustment technique, and by co-solvency method, and by reducing the particle size, and by hydrotropic technique, and by using salt formation, and by using surfactants, and by complexation method. So these are the main or very important techniques by which we can increase the solubility of the poorly soluble drugs. So in this slide we are going to discuss briefly regarding these techniques, not in detail but briefly. So what we are going to do with the co-solvency technique? Here we are using some other solvent which is water miscible. Then what happens in solubilization technique? So here we are using surfactants that will lead to the formation of miscible that is easily soluble in the liquid system. And we are going to do a chemical reaction or a reaction that is called as complexation. So here we are going to make a complex of drug and other substances, especially like cyclodextrins, that is very easily soluble in the liquid system. And by adjusting the pH, that is we are going to optimize the pH range in which the solubility is more. And definitely by reducing the particle size, this is a physical method. We are increase the, because of less particle size, there is a increased surface area in the liquid system, so that there is a more dissolution. Then by formation of salt, so we are going to form a salt of that particular drug that is very easily soluble in the present given solvent system. And by using hydrotropy technique, so here we are using hydrotropic agents to enhance the solubility.